How does racial trauma affect mental health? Have you ever wondered how experiences of racial bias and discrimination impact mental health? Racial trauma refers to the mental and emotional injury caused by these experiences, which can deeply affect individuals, particularly among Black, Indigenous, and people of color. This type of trauma acts as a chronic stressor, leading to significant mental health challenges. Research shows that racial trauma can lead to stress, anxiety, and depression. Individuals who experience racial discrimination often report increased depressive symptoms and chronic stress over time. This is not just a feeling, it has real consequences for mental health. Some incidents of racial trauma can be life-threatening or pose a risk to physical safety, which can lead to symptoms similar to post-traumatic stress disorder. These symptoms may include unwanted memories of the trauma, avoidance of reminders, negative thoughts about oneself or the world, and hypervigilance, which is a constant feeling of being on guard. People may also experience irritability, trouble concentrating, and sleep disturbances. The emotional and behavioral impacts of racial trauma can be profound. Individuals may have upsetting thoughts, experience recurring nightmares, and feel self-blame for situations beyond their control. Some may turn to self-destructive behaviors or substance use as coping mechanisms, which can further complicate their mental health. Additionally, the effects of racial trauma extend beyond mental health. Chronic exposure to such trauma is linked to physical health problems, including high blood pressure, heart disease, chronic pain, and digestive issues. This reflects how stress can manifest physically in the body. Racial trauma also affects self-identity and overall well-being. It can undermine how individuals view themselves and their place in the world, often leading to lower self-esteem and impaired well-being. This trauma can arise not only from personal experiences but also from witnessing racism or through intergenerational transmission within communities. While racial trauma is not classified as a formal mental health disorder, it can cause significant psychological distress. Understanding and addressing this trauma requires culturally competent mental health support that validates these experiences and helps individuals build resilience. Treatment approaches for trauma and PTSD can be beneficial for those affected by racial trauma. Seeking professional care is crucial for healing and recovery. In summary, racial trauma profoundly impacts mental health, causing symptoms similar to PTSD, contributing to anxiety and depression, and affecting physical health. It damages self-identity and well-being, highlighting the importance of recognition, support, and appropriate therapeutic interventions.